Good evening, ladies and gentlemen, and welcome to Perspective Nation. Today, we are going to be having a topic on mental health. Our flyer states, let's talk mental health. On the panel, we have Lanre and Dotsu, who is Dotsu is a registered psychologist in New Psychiatric Inc. in Calgary, while Lanre is here in Toronto at Behaviorprise Consulting. Without much waste of time, I would like us to start. First of all, thank you, my panelists, for being here. We really do appreciate you coming here on behalf of Perspective Nation and our guests listening and watching. We would like to express our gratefulness that you have kept all your busy schedule, cancel your appointments to be with us today to discuss this very important topic. So I would like to start straight away by letting everybody know that this is not a therapy session. This is just an opportunity for people to get information and start a conversation about mental health, especially within our families, our network, and our friends. We, however, encourage everyone to listen to what is being said today and use this opportunity to reach out if they have any mental health issues. Let me start with the lady. So please kindly tell us who you are, where you work, your specialty, and what you would like us to know about you.
So my name is Oludotun Ogunfowara, live in Calgary. I work as a psychologist. The areas that I support are mostly children and young adults. I enjoy working with that population because for me, it's kind of like a proactive approach to managing mental health overall. And I can't remember the other question.
So,
sorry, go ahead.
Yeah, so we just want to know where you work, your specialty, and what we need to know about you. Like you can talk more about what you do. I've brought up your page.
Yes.
And what are the services that you guys offer?
Yeah, so I do work with Renew Psychology. That's actually my private practice. I also do some work in other psychological clinics, helping people return to work, manage chronic pain. And I also, specialty is very diverse, but I would say maybe anxiety, depression, self-understanding is a big one. I do assessments, which is primarily to help individuals understand themselves a little bit better, mental health kind of assessments. So I do that. And yeah, what do you need to know about me? I feel when I look at my life story, it's like, it seems as if there's a plan, but then doing the dance in a way that helps you find more of yourself and less of the noise that other people tend to contribute or that the environment tend to contribute has been helpful for me in my own my story. I moved to Calgary in 1999. My first degree was in business, and after 10, 15 years of doing that, I decided to step into something else. And this was what a good friend of mine recommended when she said, you're not a very good supervisor, so you should do something else. She had said, you like to support people more than you like to support the company. So for her, she figured it would be challenging for me to move ahead in the company. And she said, go study, be a life coach or something. And so that was how I started. Not as a life coach, but the research just kind of led me to psychology. And so here I am.
Oh, thank you so much for that brilliant introduction. We'll move straight away to Lanre. So please, same thing, tell us who you are, what you do, what we need to know about you and your specialty.
Okay, thank you. And good evening, panelists and the folks that are watching or listening. So my I started out, unlike Dotsu in business, I started out in accounting. And then my sister, who happens to be a nurse, said, hey, why don't you try this? So I went into research, trying to look at what is out there and all of that. So I got into behavioral science and psychology undergraduate, and professional behavior analysis on the master's level. And I work as a board certified behavior analyst. My work is various, and I do a lot of work with people who have developmental disabilities and those who have what we define in Ontario as dual diagnosis, which is a combination of a mental health diagnosis and a developmental disability. So I work majorly with young adults and adults. We do assessments and treatment. We do ABA therapy, and we also provide training to people who desire to work with the population that we serve. So that is who I am in a nutshell.
Okay, thank you so much. So let's move ahead to the first question. So we are going to definitely put their contacts out there, especially the web links for the website for those who want to reach out. So there will be two ways for those of us listening to ask questions. You can definitely send them through the chat, or you can raise your hand. I'll definitely call you. You can make a comment or ask a question. And if there's anything that you want to be read, you can obviously put it on the chat. So our next question is, generally, there'll be some people out there who may be wondering, okay, you guys, you come out from different backgrounds, somebody with a business background, somebody from accounting, some other person is maybe an engineer. How challenging it is to become a mental health therapist? What is the process to acquire your license, basically? Larry, I'll start with you, and then maybe Dotsu would add as well.
Okay, so in the province of Ontario, for you to be a registered psychotherapist or mental health therapist, there are a number of things that need to be done, and the title registered psychotherapist is actually protected under the Act. I believe that is the Regulated Healthcare Professionals Act. So I would not consider myself a mental health therapist. I am a behavior therapist. And there's a huge difference in that. So I work with people who may have mental health issues and developmental disabilities on the behavioral side. Okay, so I don't do the counseling and all of that, but if I see that an individual who has mental health has some behavioral tendencies that is contributing and complicating their mental health issues, that is where I come to be. So if anyone wants to become a registered mental health practitioner or a registered psychotherapist in the province of Ontario, they need to go through some education, maybe counseling, psychology, or any other related degree and master's level degree. And then they will be applying to the Ontario College of Psychotherapists. Let me just show about that title. Is College of Registered Psychotherapists of Ontario. So if they want to become a licensed person, then they have to do education, go with the college, and when they pass their exams and become licensed, they can begin to practice. So that's what will happen, I think, a pathway here in Ontario. Thank you.
Thank you very much. Over to you. What is the process like? What's the process like in Alberta?
Yes, it's very different in Alberta. You do need to have a master's in counseling, and then with the College of Alberta Psychologists, there are other steps like to take an oral exam. You have to complete a residency of about 1,600 hours, and then be supervised by someone who's a registered psychologist for those 1,600 hours. And after that, there's this massive exam that I just passed last year after 2 tries. So it's not, I feel like even before one decides to get into that space, it's almost like you have to want it. And it's not, I think for me, it was a good check-in that, you're not doing this because of income potential or whatnot. It was because I was passionate about it and I wanted to do it. So that's kind of like what makes maybe the process easier, is the passion, but that's driving why you want it. Because then it doesn't matter how many exams you have to write and whatnot. I just started my doctorate program actually just last month, just because I want to. I think Dr. Dotsu sounds nice. On the side.
It does sound nice.
It really does sound nice. And it's going to sound nicer to your family and friends.
Yep.
Thank you.
So, Doctor, give us an understanding of your day-to-day activities with your new practice now. When you get up in the morning to when you get up to bed, what is the expectation?
Oh boy. Depends if you work for clinics or if you have your own private practice. For me, I do a bit of both. My day typically, not because of the work I do, but my own lifestyle, typically starts around 5:30 in the morning, just because I like to do self-care and do what I need to do for myself to start my day. And that might be usually it's going for a walk and setting the pace for my day. And I see clients in maybe 3-4 clients, take a break, and then maybe 2 more, and then that would be it for the day. Carving out self-care is something that I do intentionally, and I try to protect it as much as I can, so that because part of the ethics of psychology is you don't cause harm to the people you're supporting. So it's very important that my mindset is balanced and I don't maybe miss things that clients might be saying and such. So that's kind of like how my day is. Spend time with a lot of family and friends, because that's important. And I do have my own psychologist to help me through my own stuff too. Yeah.
Yeah, well, I think we're going to come to that to talk about how you people take care of your own self before you treat others. So, Lanre, how do you do it? What time do you get up? You get up at 5?
No, I don't. I do my walk in the evening when I finish from the office. So my day starts just getting ready with the children. My 2 girls are big enough, they can take care of themselves, but I have a boy that needs somebody to say, hey, have you showered? Did you brush your teeth? Blah, blah, blah. And so I get that done. And then afterwards, head out to work. So a typical day is not always typical for me. In some cases, it may be doing assessments. In other days, it may be doing treatment. Other days, it will be putting out fires. Like crisis. So it depends on what it is. And some days I'm teaching and training and all of that. So, but it's busy. It's something that I enjoy. And I see benefits of the work that I do with people on a daily basis. So that keeps me going.
Yeah, I'll tell you. So your practice or the way you set up your business is that you are flexible. and you being the head, do you decide, oh, I've been putting out fire the whole of this week, next week I'll be doing only training, and then you keep all patients waiting?
No, it's all scheduled, and sometimes in between you get pulled here and there. And I have associates that we work together, right? So we divvy up a caseload and help each other out, and there's no, oh, this week is all treatment or that week is all. It's just whatever comes. Sometimes it disrupts the entire schedule, right? And we have to reschedule things.
Okay. Dotun, let me come back to you. Now, trying to figure out what mental health is, it's a whole problem itself. It might create a mental health problem. So what are some of the just tell us some of the type of mental health situations or names that you deal with, and try to clarify them to us.
All right. So mental health for my lens is how you take care of your mind. So on my website, actually, in coining the website's logo and the tagline, it's that your mind is your greatest asset and you have to take care of your mind. So for me, mental health is managing the mind, because the mind is how we see the world, how we integrate the information, how we interact with our surroundings. And if you want to take, I'm not a medical specialist, but if you take a page from that, when someone's in a coma, the body's there, the brain's functioning, but something is missing. So from my lens, that's like taking care of the mental health is taking care of the mind. And that would vary from stress, burnout, anxiety, depression, PTSD, when you've experienced life-threatening events, bullying, harassment, sexual abuse. So a whole lot of things that can interrupt mental health. And sometimes you have individuals who are managing genetic things like ADHD, borderline personality disorders, and so on and so forth. It could be even with parenting, when there's over capacity of an individual. It's like too many things going on. You're a full-time worker, full-time mom. Well, there's no part-time parenting, but you're doing all of that and you're not taking care of yourself. That tends to also push the strains on mental health.
Okay, you've said a lot of terms there that we'll need to, I don't think we'll be able to discuss all of them. We might pick a couple of them and just try to talk about some of the signs and symptoms. Larry, let me go back to you. Yeah, so what are some of the mental health or behavioral issues that you deal with?
It will be, like I said, mostly what we call dual diagnosis, which is a combination of a mental health diagnosis and a developmental disability in one person. So you could have somebody who has autism and also has bipolar disorder, or somebody who has autism and also has schizophrenia, or has some anxiety disorder or depression and all of those. So or what is called obsessive compulsive disorder. So these individuals are even more complicated than if the person just has a mental health issue. So in my experience, I see mental health and developmental disabilities in the same person, and the two contributes to the condition that the individual may be facing.
So let me get this clear. Like someone like me, I'm not a therapist. I don't know these terms. Can you make the difference to a lay person like me between a behavioral disability and a mental health?
You mean a developmental disability and a mental health?
Yes.
Sure. Okay, so a developmental disability is something that stays with the individual from when it was diagnosed. In some cases, some people, they know that they will have a developmental disability right from when the mother is pregnant with the child. Okay, all the way, and it stays, it's lifelong for people. Mental health, a mental health diagnosis such as maybe depression will be diagnosed much later in life, maybe as the individual is growing up. Bipolar disorder, the same thing. Obsessive compulsive disorder, the same thing. Anxiety, the same thing. They are not typically present at birth. A developmental disability may be present at birth, or maybe in the early years, like maybe age 1, 2, 3, they get the diagnosis, and then mental health comes later, maybe because of so many different factors.
Okay, I think that is clear. So let's move a bit forward to the pandemic. You know, due to the pandemic, we've learned about burnout, depression, some of the things that Dotsu was talking about, stress, uncertainty. And this is not just happening to adults. You know, there are cases of young teenagers or pre-teenagers and mothers, parents. So can you use the challenges we have as due to the pandemic as an example to discuss some of the mental issues that we can experience, especially dealing with our children, Dr. Dutton?
Yeah, so I think during the pandemic, when parents became teachers, there was an increase in demand for psychological assessments, because parents all of a sudden see their children more often and they feel like they're not performing as they should, and they want an assessment to be done. Children also reacted in the sense of, at least from what I saw, is the idea of being tired of viewing the screens all the time. The screen it was something they enjoyed, but now it's like too much of it. And there's the need to replace it with other things. Having to set boundaries became a very important thing in families. So working from home, studying from home, everyone, you know, part of the strategies that was offered at that time is to carve out time and almost sometimes physical boundaries between you and your workspace. It's like, okay, I'm done work and I will leave work. For me, it started a little bit where I would get irritated more towards the end of the day, and I couldn't quite figure it out. But by the time I got to it, it's like I have this tendency, it's like, oh, it's just one more email, it's just one more email to respond to. But I had to step away from my desk, lock my office door. In fact, I would put my laptop in my briefcase and lock the briefcase so I don't easily access it. So that's the kind of thing, like it stretched, the pandemic really stretched us to certain limits that we didn't experience before. And people had to look for different ways of being. The social gatherings that were curtailed, going for a walk. Even this year, when I had my first handshake after the pandemic, it felt really strange. I had this 3-year-old that I was working with, and I said, you know, what's exciting about going back to school? I said, well, now we don't have to wear masks. I can see everybody's faces. So sometimes that kind of impact of the social interaction, I'm sure there are lots of people doing researches to see how the pandemic has actually affected us, but I can see it in how people interact. Even people who would say, okay, I don't like other people, I'm a loner and I don't want social interactions, got to the point where they're like, yeah, I think I miss seeing people on the streets now. So that, especially with depression and anxiety, it really was not, it was tough.
Lanre, did you see any changes due to the pandemic in your practice, in your offices?
Yeah, so For a lot of the guys that I work with, before the pandemic, we would have a lot of behavioral crisis to deal with and all of that. But during the pandemic, when it was just starting, we didn't see those behaviors. And we were wondering what's going on here. Apparently, what's been going on is the individuals that some of the individuals that I've been working with, they really didn't want to go out, but we wake them up in the morning, it's time to go, and it's time to do this, and it's time to do that. So we did a whole lot of all those things. And it's becoming clearer and clearer that some of the behaviors we're seeing then were because that we were kind of putting demands on these guys. And so when the pandemic hit and they didn't have to go anywhere, they were just sleeping in and eating at any time and doing nothing. Those guys did not protest. They did not destroy property. They did not engage in all those inappropriate, challenging behaviors. On the other side, there were people who had issues. People who couldn't figure out, why am I not going out? Why are we not doing this? Why are we not doing the things that we typically do? And some of them couldn't understand what this pandemic thing is all about. Why can't my parents come to visit me? Why can't I go to my parents' house? So they couldn't do that. And we have not really seen the volume of the mental health issues that are resultant of the pandemic. We've not seen. They're just developing, and there's going to be this is my opinion, there's going to be some kind of explosion of mental health issues in the next few months to a year or so, because people are just getting out, and some don't have the resources to cope with what they went through during the pandemic. In the pandemic, a lot of people lost their jobs, and they were not sure about what's going to happen next and how am I going to do this, and all this stuff. They contribute to mental health situations.
Yeah. And if I may add, I feel like for me, I had to take a leave of absence even during that time, because treatment programs that would normally take 6 to 8 weeks, and we see that people are getting better, was taking longer. And so that meant we were all working harder. And so, checking in and say, yeah, I need to step away so that I can take care of me and then come back. That was really important.
So with all these disruptions, what do you do with some of the care and the therapy that you have planned out, and you had some patients that were already responding to it? What happens? You change the therapy? How does that affect the patient?
Well, from counseling psychology lens, I don't think, at least the way it works, it's not necessarily that you have a planned treatment plan. You just kind of sort of do the dance with the person to see what fits and what's happening and what's helping. There was the idea of transitioning to online therapy, virtual, and wearing masks during sessions. So it didn't really disrupt per se from my end. If anything, people had to just adapt to the different way of doing accessing services.
Lanre, is it the same situation with you? You have more complex situations. Do you have people with long-term therapy, and then you have the pandemic and they're just sleeping and eating, and then they come back and start all over? Or how does it work?
No, so unlike what Dotsu's practice is, we see people, we have a treatment plan, we go with the treatment plan, and we have a number of sessions or sessions that we would run that. And if we do that for maybe 10 sessions or 3 months in some cases, and we don't see a response, then we have to go back and reassess to be sure that we got it right. And the treatment is actually right for the person. So if we try something and it's not working, then we just have to quickly go back and try to figure out what's going on.
Oh, okay. For those of you who just joined and those of you who have access to the chat, I have put on contacts to the website of our panelists here. So please go check it out. At the end, we might have to put their phone numbers as well. Again, if you have any questions, do not hesitate to ask, raise your hand or send them through the chat. Now, let's dive down and really talk about one thing or one word that we've been hearing maybe since we're in secondary school or young: depression. Doctor, what is depression? And how do I know if I don't have depression?
Oh, me?
Yes.
I'm sorry. Gosh, depression is sadness that just doesn't go away for extended period of time. The ways that you'd, gauge depression is isolation, pulling away from social interactions, preference to be alone, isolating yourself. Things that you used to enjoy no longer kind of do it for you. And you're starting to, it's almost like you're withdrawing into a shell of yourself. It's hard to get motivated to do things. So those are kind of, so if you look at a teenager in a family setting, someone that would maybe usually come out and laugh might be more in their room and not saying much. Sometimes you're oversleeping, undersleeping, overeating, undereating. So it's a lot, it will vary how it shows up for an individual.
So what are some of the triggers? What are some of the things that would cause somebody to be depressed?
Is that for me or for Lanre?
Yeah, yes. Oh, Lanre, you can come in if you want to answer the question. We're trying to find out what are some of the things that will cause somebody to be depressed.
So I'm sure that this will be something that is up Dotsun's alley as well. The diagnosis of depression is usually, or let me not just say depression, mental health in general is multidimensional. So you could have biological factors, which would have to be do with genetics and family history and all that in the background. And then you have psychological factors, and you have behavioral reasons, cognitive reasons in there. You may have emotional factors and social factors. All of these things, they come together and not independent. They come together in one complex bind and create these conditions that we're talking about. So you can't really say there is one thing that is responsible for depression or other mental health issues. There's a combination of these factors. And so when people begin to look at these conditions, clinicians would, Dotsu will come look at the psychological side, somebody else will come look at the biological side, I can look at the behavioral side and the social side, and we all come together and contribute our expertise to the diagnosis of to the treatment of the person. The DSM-5 specifies exactly what the person needs to be doing for them to get a diagnosis of depression, to specifically answer that question about depression.
Okay.
And just to add to that, sorry, it is a different factors. And I feel like for me, in my own personal story, depression was more of that social pressure, feeling like you're not good enough, you're not measuring up enough. and people are demanding that, not directly demanding, but there's that expectation that, hey, this is where you should be, this is what you should be showing up as, and you're not meeting that, and you feel like you're letting people down. Depression can be within genetics, where there's just that natural predisposition to it. I feel like we all have almost like cancer cells. We all have it. It's like something triggers it in the environment, right? So all emotions are valid from my lens, my worldview. Something occurs in the environment that kind of pushes a person, and then they have to deal with the impact of that.
Okay, let's go to a controversial topic within the Black community, especially ADHD. A lot of Black parents feel that their kids are overdiagnosed. Is that true? Or how is the process of diagnosis?
I feel North America, we have more diagnoses for ADHD kids than anywhere else in the world. Sometimes it's maybe the expectations. I do ADHD diagnosis, so I do, well, caveat here. I feel the social expectations and demands on children tend to also impact. I mean, I have two daughters, and one of them, she's very full of energy, and she's not the one that would sit down for 3 minutes. She needs to keep moving, kind of thing. So when that kind of person is in an environment where they're expected to sit down and listen, and they're not following that social expectation, it's like, well, then it's not happening. It feels like you're not able to regulate yourself. ADHD, the parts of it that really impacts the person is if the person is not able to organize their ideas. I feel like that's more of the area of focus. If you can't kind of like think about the executive functions as the CEO of a company. If you can't make decisions to run the company, can't make decisions to put the company in safe ways and start projects, finish projects, that's when ADHD is problematic.
Can I just add something to what Dr. is saying there? So in schools, there are expectations, just like she's describing, that kids, typically developing children, should behave a certain way. If they are not, teachers begin to say, that boy is too hyper, that girl is too active. And then they begin to say it. And guess what? If you tell yourself something too frequently, you start believing it, and you start seeing the child through that lens. Teachers, principals cannot diagnose a person with anything. So when some Black kids, or whatever their background is, when they go to school and they don't fit that norm, the teachers generally begin to say, looks like this child has something. You should go check this child out. It seems like the child has ADHD. What I say to parents that I see is, tell that teacher that you cannot make such comments. Because even I'm a behavior analyst, I work with these guys, but according to my training, I cannot even diagnose somebody of having ADHD, okay? The people that can do diagnosis are very specific, and they have specific training. So some teacher in some high school or elementary school should not be telling you that. If you have concerns as a parent that my child is too active, go to your pediatrician, go to your family doctor, let a doctor look at that child, and then recommend to you what you need to do. In a lot of cases, the doctors will say, I don't see anything wrong here. If the doctor says that, go with that. If you are still troubled, get a second opinion from another doctor, not from a teacher. We need to learn to listen to the professionals that are trained to do exactly that kind of job.
Yes, but even me growing up in Africa, we had I have family members, classmates who are never paying attention. We have people who we nickname them shakes because they're always shaking. Is that not a good case for us to diagnose as a problem?
Well, I would say, you know, what Lanre did say, align with that. You and your child, or if it's you looking at yourself, you have to create that awareness to see if it is a problem or not. When parents ask for assessment, ADHD assessment, or even adults, I usually say, you know, the expectation that a child should sit down and be still, it doesn't make sense. Because if you look, even in the animal kingdom, right? The cubs are the ones that are running and jumping from tree to tree. The older animals just kind of sit there and relax because the energy levels are different. But if an individual, if people, actually I got 3 referrals for an assessment and all the kids were in the same class. And it was strange. By the time we got to the bottom of it, it was the same teacher that referred the 3 children for an assessment. So it was more like, okay, this teacher, maybe they're overwhelmed, maybe their expectation of what the kids can do or what kids should do is just not aligning, and maybe they're not being flexible in that sense.
Okay, we've talked a lot about that. Let's talk about stress. What are some of what is stress, by the way? Let's start there. Lanre, what is stress? Not financial, mental stress.
Yeah.
Financial stress, we have the definition.
I think stress is more like how we what we feel when we feel like we do not have the resources to deal with certain situations, or we're just tired of dealing with a particular situation. We've been going on and on and on, and we don't have the rest that we need. We don't have time for self-care. That can cause a whole lot of other conditions for us. So thinking about things, and there's something called it's cognitive distortions or cognitive errors. The way we think about situations that we face. Though if we have cognitive errors, which are rigid ways of thinking about things, and those thought processes are wrong, if you have one of those, you may look at a situation and overthink and overprocess, and then you stress yourself and find out that you're not able to cope with the situation. So it's something that we all deal with. We individually have ways that we deal with them, but sometimes some of us do not have the resources to deal with the stress, and then it graduates into something else, and a serious mental health problem.
For me, so I love working with stress, because then I do no, I've had to reframe what stress is, because it is different for everybody. Everyone's perception of what stresses them out is very much determined, like Lanre said, the resources and what you think is your capacity to manage stress. There's a video on TikTok that I usually recommend for people to watch. It's how to make stress your friend. Essentially, it's saying, instead of trying to run away from stress, kind of reframe it, embrace it, because it's part of life, right? Stress is what also helps us to grow and problem solve. So from my end, I don't advocate trying to avoid stress, but rather, what's stressing you out? Can you have a strategic way to solve the problem? If it's within your control, if it's outside your control, who can you call? Who are your community kind of network? If you need that additional hands to help you.
Is that video by Kelly
McGonagall, yes.
Okay, I'm
Yes.
going to I'm going to post it up there, so anybody who wants to, I'm going to post the link.
Yes,
So
it's hilarious. I feel like it's a nice dosage of how to manage stress.
Yeah, I'm definitely going to watch it, and I'll put out the link there. So yeah, as I said, we can't discuss all of this, and we're already halfway above our time. So we've talked stress, depression. Let's give very, very short discussion on alcoholism. Because that's one of the things that we, coming from Africa and some communities, if you cannot drink too much, then you're not a man. So what is your opinion about what's your opinion about alcoholism and treatment? Lanre?
Yeah. Okay, so I'm just thinking about.
Let's move towards self-coping mechanism. That's where I'm trying to drive through.
Yeah, the way you premised your question, I was like, am I really a man now? Because I don't drink.
It depends on your culture. It depends on
Yeah. So you see, it's alcoholism it's an addiction. Because if people don't start out as alcoholics, they start out as, hey, I'm going to have a drink. And then if you're able to drink one bottle, you're good. You may be encouraged by your friends to do more, and then you do more, and you're good. And after some time, you can take 4 bottles and you're good. And then your system becomes tolerant to the alcohol, and you need even more bottles to get you to that high level that you want to be, or the whatever alcohol does to them. And then they just keep going on and on and on. So it is a form of addiction that actually messes up with a lot of people's lives. And I think just thinking that if you don't drink, then you are not man enough is in itself an error in thinking. You can drink moderately, know your limits. If you don't know your limit, then don't drink at all. Alcoholism is something that a lot of people deal with, and it is a serious problem for a lot of people. And I would add drug or substance abuse to that as well. You take it and you start taking it, and your body becomes tolerant, and then you keep going on and on, and you don't know how to stop. So it's a very serious problem. It's killed a lot of people now, taking it into substance abuse. So I'm not sure if I'm just to describe it, or what was the question really, Efranga?
So I was talking about, I wanted us to talk more about some of us, we have all this depression, stress and all whatnot, and we self-medicate using alcohol and drugs, as you put it. So my question is, when you come from a community or you have a network of friends who push you towards these things, what can those friends do? Or what should we know as friends if somebody is an alcoholic near us? Should we be pushing this? Go ahead.
I feel like the starting point would be, how often is the person drinking? Are they drinking when they're alone? Because like Lanre said, addiction, it is a kind of addiction. And it is also, for me, if I'm supporting someone that's experiencing substance misuse, it's usually, some kind of trauma behind it. Like, what are you running from? What is it that you don't want to deal with, that you'd rather drown in whatever substance you choose to use, which can be alcohol, drugs, sex, shopping, food. So there's all sorts of things if you open it up that way. It's when it becomes something that's almost running you, like you're running towards it, and you can't wait to get home and open up that wine or go on that porn sites to do something. It's essentially we're running away from something, or we're not dealing with something.
Okay, so let's move and talk about stigma. I know the mental health is a huge topic. Let's talk about stigma. So on this show, we're about 15, 16 people. And I read somewhere that I think 1 in every 4 persons have a mental health issue or something. So 4 people within our community right now might be suffering. Why don't we, what are we going to do so that some of us who are suffering and sit quiet can actually go get the therapy that we need? We have so many things that we always put before therapy. What are you going to advise us to do?
My thing is like, you almost have to cross that line and speak for yourself, advocate for yourself. Putting things under wraps, pretending it's okay, only makes things bigger and worse, right? So I did a few attendance that's very Black community oriented, and no one came to the table to talk, and that says a lot, right? Because we are afraid people will judge us, but you have to think about what you need as opposed to what everybody else is saying, because that's you have to override that first.
Lanre, same to you. What should we do? How do we go above that line and be comfortable enough to discuss mental health issues?
Okay, you see, let me look at it this way. Anytime you say mental health, somebody thinks something is wrong with your brain. You have a problem. So if I say I'm going to see a therapist, somebody is going to think, what's wrong with you? Why do you need a therapist? I'm going to see a psychologist. What? You're going to see a psychologist? So I think there's a stigma. I don't know where it came from. Maybe it's over time, with just seeking that kind of help. If I say I'm going to see a doctor, everybody, oh yeah, okay. But the moment you say something, it looks like, hey, something is wrong with you. So some people, they know they have a problem, but they are not comfortable going to seek for that help because of the stigma around it. Some don't know that they have a problem. They just keep doing what they're doing. And if you dare suggest that they have a problem, then there's going to be a bigger problem. So how do we handle these two sets of people? The first people who don't know that they have a problem, you don't just go telling them that they have a problem. Sometimes you see a couple who are having issues, and the husband believes that he's right, he doesn't have a problem. The wife believes that she's right, she doesn't have a problem. They will not seek counseling, they will just keep blaming the other person. So how do we get them to see somebody and get help? How do I don't think I have alcoholism. I don't think I have an issue. I'm in control, except of the few times that I make mistakes. So how do I get myself to help when I don't know that I have a problem? I'm still thinking about how to do that, and it will be something that I would say should be approached on an individual basis. There are some people you suggest to them that, oh, I think we should go talk to this person, and they'll say, okay. There are some you suggested to them, and they will be mad at you, So that is one class and one way of dealing with that. But the people who know, I'm almost tempted to say, one of the ways would be to change the name of the therapist, or change. Don't say you have a mental health issue, or you just, I need help with, managing this alcohol. That could be it.
Okay, we have a hand up. B, can you unmute yourself and ask your question or make a comment? Thank you.
Thank you so much, Ifange. Thank you to the panel. It's a really great topic, especially to me as an individual. So I have this question, like, there are so many people out there that they don't really like to share they know that they have a problem, but they don't like sharing it, be it to a therapist or whosoever. How can you guys advise, like, what can such a person do in order to overcome maybe depression, or if the person is having, okay, let me just say depression. Yeah. What can such a person do? The person doesn't like talking to any person about her problem or his problem, but she wants a solution. How can you help such a person?
So in Alberta, or in most provinces, there is the distress center that you can call anonymously. That's one way to go. If it's specifically with depression, it would almost be part of the ways you can do self-help is to change scenery. Like if you're always in your room, closing the blinds and you want everywhere dark, you need to go outside. You need to talk to someone, you need to see a different setting. So even if you move from your bedroom to your living room, that would make a change. Going for a walk, as simple as it sounds, or sometimes that can also be something that's hard to fit in. But even if it's 10 minutes, 5 minutes that you go and do a walk for, you will, there's benefits to that, because then you get some of those neuro transmitters kind of juice producing. In terms of maybe just general mental health, when I see clients, I usually say, think about mental health like you do your physical checkup, you do your dental checkup. Mental health is not only for troubled times, it can also be an enhancement. I have worked with people who are high functioning and they're just looking for ways to manage the demands that they have. When family work is doing well, business is doing well, but family life just seems to be put in the back burner because of work or because of school. So I usually just say, do a mental health checkup. It's just like any part of your body or any part of your experiences. You do spiritual stuff, you do social stuff. Well, mental health also need attendance.
Okay, Dr. Njinking, unmute yourself, make a comment or ask a question.
Sorry, before you go, I just wanted to suggest that in case somebody wants help in Ontario, the GTA, to be specific, there's a number that you could call as well as 310-COPE, 310-COPE. You could call that number and there will be somebody on the other end to speak to you. If you don't want to mention your name, you just talk. And if you don't want that, you could actually go online. I was looking for a therapist recently, a psychotherapist for a client of mine. And I just did the quick search and I found Behaviorprise.com. They have database of therapists that are in your area. So you just enter your postal code and it will bring, it will give you a list of therapists that are close to you. You can do something online if you don't want to go in person, but those are some resources that you could use. Thank you.
All right, thank you, Mary. I've put up the 310-COPE, the phone number, as well as the bark.com. And the Dr. Dotsu has also put, I think, the stress center for Alberta. Dr. Njinking, go ahead.
Yeah, thank you for the opportunity. Great talk. Thanks to the panelists. I mean, it's very important that we're talking about this in a community. I do have like a question, comment. We've covered a lot of topics, and what I have a comment or question about is ADHD, because what the panel talked about was mainly about the fact that there is a likelihood that kids from our community are overdiagnosed with this condition. And my question to the panelists is it it's true that teachers should not make diagnosis, but is it something that you think that the community should be concerned about, ADHD?
I feel that comes down to each individual family unit. Having said that, it's in my own family circle, the diagnosis comes in, but we know that it just means that this person needs to learn to do certain things to adapt in the community and the social constructs that they're in. When I diagnose children, and I would say maybe the clientele or the ones that I've done, it's been a mixture of everybody. It's not more of the Black community than any other community from what I have experienced in my own practice. And when I do tell individuals or kids, like, ADHD has its advantages. The advantage is they see big picture. They can make decisions really fast and quick. If you have, people on Wall Street, they make calculated kind of calls, and the decisions need to be made fast, and it's sometimes impulsive if it's not well done. That doesn't mean that the person doesn't have other ways to function. So for me, I just label it for kids that, it just means you have to learn how to be in this community differently. I don't know if that answers or that contributes or makes sense in any way.
Yeah, it does. And I can speak from my own personal experience, right? ADHD is something that I have, just read a lot about because I was diagnosed as an adult with ADHD, right? And that diagnosis gave me time to reflect about my life. And I could appreciate a lot of things that I had experienced in my life that I wasn't aware was attributable to ADHD, right? And the treatments that I have that I have had, both pharmacological and psychotherapy, has been very, very useful. So in my own personal experience, I accepted the diagnosis, and I think that is something that in our community we don't talk about a lot. But I have seen some changes in my own personal life, right, following that diagnosis. Right.
Yeah.
So yeah, I just, I felt that I should share this experience with the audience, and maybe, it might encourage somebody.
Yeah. So, well, I didn't actually test myself, but through the process of testing and practicing the assessment with myself to kind of get better at it, I came out as a functional ADHD. I feel like if you look at the medical biological side of things, the brain, the ADHD brain looks different from the regular brain. So there is something there. And that's what I mean when I say it means you have to learn something to cope with however it shows up for you. So it is a real thing. However, it doesn't mean the person can't learn or improve. So that's kind of like my take on that.
Thank you, Nji Kim, for sharing that with us. I'd like to also say that, you know, there are people, I don't want to say in the Black community, but we don't even sometimes want to know what is wrong. And so we shy away from it. My comment earlier about not allowing people to tell you you have something, people who are not qualified to tell you, we need to keep that very seriously. However, when you do get the diagnosis, it helps to understand, like you said, your life. Like when I was in school, I could relate to a lot of guys that we were in school together and what they were going through. Although I couldn't diagnose them, but I was saying, oh, that sounds exactly the way Anthony was behaving and the way he did his stuff, and everybody would laugh at him, or he would always get in trouble, those kinds of things. There is always, not always, sometimes you have people who are misdiagnosed, some people who are not diagnosed at all, and they don't understand what's wrong with them, and they can't understand, why am I behaving this way? And they attribute it to so many things. So thanks for sharing that. And it is very real. Whatever we do, we have to balance it. On the one hand, don't let anybody tell you what or who you are if they're not qualified to do it. When you do get the diagnosis or whatever it is that is bothering you, just look at it and get the treatment that you need. Because some people really, like Dotsu was sharing, really need that help. And if they don't get it, then, you know, they may never be able to achieve their full potential.
Okay, let me just read.
Can I just add?
Go ahead, Dr. Njike.
Yeah, so I was just gonna add that we tend to focus a lot, I mean, in general in the community, we tend to focus on the type of ADHD, which is known as a hyperactivity type, right? They actually, you know, they are predominantly hyperactive and predominantly inattentive types. And also the other thing that I should note is that manifestation of ADHD might be different in boys versus girls, right? Just because, you know, there are certain conditions that present differently in the different genders, right? So for a boy, it might be, you know, climbing the tree, running up and down. But for a girl, it might just be the finger is in the mouth all the time, right? Or she's not sitting still at home and things like that, right? So those are some of these subtle things that we see with ADHD. Yeah, I just wanted to throw that in there. Thanks.
Sorry, if I can just add one more. For me, it's talking too much. And from primary 3 all the way to primary 6, Dotun talks too much. And it was such a big problem because I would always be on the noisemakers list and get into trouble. And I never really understood that.
Oh, okay. I think that's a good example that most people can relate. Being a troublemaker doesn't make you a criminal, just that you had a you had a disability.
Yeah, but there are actually advantages as well of having ADHD, right? That ability to hyper focus, right? And to, right, we don't panic in, like, if there's a fire, for instance, you know, and people with ADHD are usually the calmest people in the room, right? So there's some strengths, and that's what I tend to focus on, like, how can I utilize the strengths, right, to improve on my job, you know, my life, my relationships, and things like that, right? So I tend to focus on the benefits that I can get from this condition, as opposed to, you know, the stereotype and all the other stuff that people associate that with. Yeah.
Let me just come in here and ask a question to Lanre. Listening to what you people are saying and discussing about the ADHD, is it ADHD? I don't know. Anyway, so my thinking is it not even better for the family to know what you are going on? You know, if they know that you are very patient, you are very calm, like then I have to treat you differently. Like if I'm rushing out, I'm like, okay, he's always going to be behind. Or if he's talking too much, I just need to know that, oh, that's who this person is. Is that not?
It's really helpful. Yeah, it's really super helpful to know, because it equips the person to know themselves and how they interact, and then they can teach the people around them. Like my youngest daughter, oh gosh, if you post this on YouTube, when she was younger, you can follow her. When you come into the house, you know where she has been, because it's as if she's taking all the pieces of clothing off from the door. She doesn't hang the jacket. The shoes go somewhere. You can find backpack in, I don't know, in the washroom, and the homework is there. So it just means like, hey, you know what? We need to help you learn how to organize your stuff. And that's a skill that almost anybody could use.
I'm sure as a therapist, you treated that differently from others who are not therapists, because African parents will just scream our heads off.
Actually, it's funny because when I did say to her, like, she had an assessment done, and she said, don't worry, Jesus will take care of it. I'll just pray. And I'm like, yes, that might be true, but this is like, you have to work, you have to learn, you have to get the skills. The help is there, right, to manage that. Yeah.
In a number of cases that I've seen, like I've supported parents in school meetings and all of that. And this has been with boys predominantly. The school believes that the child has something, that's why he's so disorganized. And when you see where they're pushing the parents towards is, go see a doctor, go see a doctor. And what they're suggesting ever so softly is this guy needs medication. And parents are afraid of the medication, and rightfully so. You just don't want to medicate this child so that the child sits down like that and is not active anymore. That's going to make the teacher happy. So parents just are afraid of those medications and the side effects that they're going to have and all of that. So it is a real problem. And like Dotsu was saying earlier, it's a family to family situation, and the family needs to make a decision as to what they are going to do and how they're going to handle that child. Is it pharmacological treatment or some kind of behavior treatment or some kind of counseling?
Well, research would suggest that a hybrid of all the things you put on the table is the best. Because if you use just medication without teaching the person strategies, they're still not at that optimal functioning, right? If they miss the medication or they stop using the medication, the skills level is still not developed.
That's
okay.
Right.
We are running out of time, and this is the interesting thing about Perspective Nation. I prepared questions as a moderator, and then I asked half, and then we run out of time. Let me read some comments, and then I'll go back to Professor Fortier, whose hand has been up for some time. So we have a comment here, which is basically thanking you. Very informative panel advice. Thanks. We'd like to know how intervene. Oh, it's the same person whose hand is up. Fortier, please unmute yourself. You can answer the question or make a comment.
Okay, no, good evening, everybody. I'm listening with a lot of attention. Sorry, my camera is not working very well, so if I put it on the go. So it's just been a great conversation from both of you and even from Dr. Njinke. I just had a number of things that well, ask that when I came to North America and I learned of the high incidence of children, even before their teens, who are depressed, it was actually one of my first cultural shock. How can children be depressed? Because when I grew up, the idea of a child can be depressed was not something that we even thought was possible, because they are supposed to be playing and active. So where do they have time to be depressed? So for you who are the expert there, I would really like to know, what is that environmental issues that make children so prone to depression here? I can think of loneliness as maybe the main one, but what else? I think you did mention something about what they do in school. So I want to know, and when you were talking about what you did in school, I was in Botswana for some time, and I had a colleague whose son was declared problematic child in the school. They were still in preschool. And luckily, she eventually took the son to a different school, and he was actually a high achiever. He became actually one of the highest achiever in the country. But if he had remained in that school, he was beyond, they were put on medication and so on. It was this English medium type of school. But I think the main thing for me that concerns me is here, why is there such a high prevalence of children being depressed, being in mental homes and so on? What is causing that here? And I am just new here in Canada. I've been permanent here for about 3 years, and I can begin to diagnose myself as having gone through periods of serious stress to depression, because I've done lectures, I've done research in depression, so I can diagnose myself that I'm crossing the boundary. So just within 3 years here, I found myself where I have to do a lot of personal talk and try to go and do exercises and so on. And so I can relate to say maybe our environment is creating a problem. From you here, what is really causing this high incidence of children depression and so on?
Let Larry answer, and then if the doctor has something to add, she will.
Okay, so I'm just going off of what you have in the chat and what you've described. So if you have you move from a country to another country, that's a big move. First of all, you come into the country and there are so many things that are different. Now, how do you cope with those things is one thing. Then do you have any predisposition, that's biological factors that may contribute to having a mental health diagnosis? There are some people who actually have the predisposition, but they may not. So for example, let's say that my mom, my dad was depressed, and maybe I didn't even know it. I won't really, maybe because of the way I live my life, I'm a happy guy, I have a lot of people around me, I may not be depressed. But if I have a child, my child also carries a predisposition. If my child then decides to do something, and that something puts that child in a position where they experience loneliness or some serious environmental situation, environmental change, that child may then begin to experience something, and you wonder where it's coming from. So like we said before, there's a very complex combination of these factors, biological factors, and then you have the psychological, behavioral, social factors that come to play and produce these conditions. So I've heard people who say that, oh, maybe there is, why do we have more diagnosis here than maybe in Africa or in other places? And I say that, you know, I think there are a number of reasons, but one of the reasons that I give is the fact that in our environment, you have a lot of clinicians who are doing diagnosis. But in the other cultures, let's say Africa, for example, who has time to go and get a diagnosis? The people who get diagnosis are the ones that you've beaten them and they didn't respond. You've harassed them and they didn't respond. People have laughed at them and they didn't respond. Then maybe the parents will do something. And that would even be parents who are able to afford to get diagnosis. So a lot of people are back in Africa who actually could get a diagnosis, but they're not, because of the environment, because of the economic status, and so many other reasons. So people are here, they're getting the help that they need, they're getting the diagnosis that they need. I wouldn't say it is happening here a lot. I would say it's just that we are getting diagnosed better or more than in other places. I'll yield to Dotsu to add a few to that.
We are running out of time. We are running out of time. I'm sorry, I have to. It's been a really interesting discussion. I would like to call Lady Abba here. She's an author and my sister, to make a comment. Then I'll come back to our panelists to give us a final word before we close. Lady Abba, so let's talk about your book.
Actually, I don't want to talk about my book, so sorry, but I do want to thank
Okay, I'll talk about the book before you talk about whatever you want to talk. So she has written a book, and I'm going to advise everybody to lay their hands on that book. It's a combination of stories that she's put together. I'm telling you, each of those stories, they are going to change who you are. I don't know where she got the people to say those stories and where she got the idea to put all of them into a book. It's called Why Me? I think that's the big topic, why me? And she has her own story in there as well. So I read the book, and I'm just telling you that maybe in the next month or so, we'll talk about the book. We'll have a whole session just to talk about that book. Now you can say whatever you want to say.
Thank you so much. I really appreciate that. And believe you me, I've been hearing so many the reviews, and everything is said is just what everybody is saying. But thank you. I want to say thank you so much, Ms. Ogunfowara and Mr. Duvile. I just want to put something, into the mix. When we come to places like this, we experience different things that can actually affect our mental well-being. It could be the way we're addressed. We all know, and some people do not agree, but I do know there is systemic anti-Black racism in this country. It's embedded in what Canada is. And then I come here, and then some of the names I'm called is minority. All those, it seems like they just bullying. That's the way I see it, just bullying us. And then the fact that a lot of people have had a good life before coming here, and then they have to start from scratch. It really takes, to be candid, the grace of God not to fall into, what we're talking about here. I don't know if I know he said there's no time. I don't know if you can still just say something about that, because what we're experiencing may not necessarily need medication. It may be that we need somebody to talk to, because this country is actually very lonely. I don't know if you have anything you want to add to that.
Well, I'll say when I first moved to Calgary in 1999, my mom was very quick to move back to Nigeria. She said, I've lived here and I don't even know who my neighbor is. That's how secluded it can be. So the idea of new space removed from maybe your regular support system, the idea of having to start again, and the adjustment to the weather, because even when you think about it, wintertime, people tend to say, oh, there's the winter blues, and then summertime comes and it's like it's been lifted. So there's a lot of all of those things that, yes, it does impact. If you apply for a job 4 or 5 times and you're being told no, if you and your partner are not able to communicate like you normally would, and back home, when you have kids, your neighbors, there are lots of help around. It really does take a village to raise a child. Meanwhile, here you have to have things in place, unless you have that community of friends around you. So you're doing a lot more work here on your own than if it was back home. Okay. That's my my lens. Yeah.
Well, I think there's really a lot that we can still discuss. Unfortunately, we programmed this for 1 hour, 30 minutes. We are already running, we are over time already. So I'll go back to Lanre and then Dotun. So please just tell us one thing that everybody should take away from this discussion, and conclude by telling us how we can reach you so we can round up. Lanre, what is what is the one thing that you think everybody has to take from this discussion?
Okay, so just quickly, mental health problems are real, and Black people do experience mental health problems. We sometimes dismiss them, and maybe we are over spiritual about them, but they're real. And if you feel anything, you're not sure, talk to somebody. If you don't want to go to see somebody in a clinic, make a phone call. Dotun shared a resource with us, and I shared 310 code. There's Canadian mental health associations everywhere. Go talk to somebody, maybe online, over the phone, or in person. Don't allow your mental health condition to push you over the edge. If you need to reach me, you can call me 416-742-3282, or by email, Lanre, Lanre @behaviorprise.com. And I'll be happy to help or redirect you to where you can get the help that you need. Thank you.
For me, I would say if there's one thing that I'm hoping people take away today, is that mental health is no different than your physical health, and to take it seriously. You brush your teeth every day for a reason. So by the time you get to the dentist, it's not like it's painful and it's degraded. That's the same idea that I would encourage you to look at your mental health. Is something you have to take care of daily basis, as frequently as you can. To reach me, if you are in Alberta, we can work together. But if you're not in Alberta, I'm licensed only for Alberta and Yukon, not in Ontario. Phone number would be 587-402-3631. And you can reach me at Dotsu, that's DOTUN, at renewpsychology.com.
Okay, thank you very much. I have pasted their websites on the chat, so if anybody wants to reach them, you can go through that way. I've also pasted a link. One of the challenges we get is that some people say, oh, they don't get the reminder. So there is a WhatsApp group for Perspective Nation. Just to remind you, there is a link there as well. I'm going to read the last comments and then we'll call it a day. So we had a comment from the cause of depression is multifunctional prevalence may be higher in this part of the world of West Africa. I don't know if I think it should be West Africa.
Versus West Africa.
Oh, versus West Africa, in part due to social isolation, overdiagnosis, pharmaceuticals pushing for business. Psychotic drugs remain the highest prescribed in this part of the world. And then we had a thank you so much for sharing and empowering us. We really appreciate you both. Again, I think there's not much I can say. Again, on Perspective Nation, we usually have these topics, but it's always a problem of time. Today, we're not able to talk much about stigma. We're not able to talk about access to therapy and services. We're not able to talk much about some of the challenges, but we hope that anybody who's been listening will take these ideas that we've discussed today and take it forward. Again, thank you, Lanre. Thank you, Dotun. It's been a wonderful, wonderful pleasure. One of the things that we try to do here is to connect professionals. I don't know if both of you know each other before here. If not, or definitely share your contacts, and hopefully next time somebody reaches out to Lanre and the person is moving over to Calgary, you will not be looking for another person or telling, oh, I don't know anybody there. We can definitely link up. Thank
For
you so
sure.
much. It's been a pleasure having you. On behalf of Perspective Nation, we want to say we do appreciate the time that we spent with you.
Thank you. Thanks,
Thank you
everyone.
very much. Thank
And
you.
those listening, please, this is your time to turn on your cameras, unmute yourself, and thank our panel.
All the best with your book, Lady Abba.
Thank you, sir. Thank you.
Dr. Jiken, good to
Thank
see you.
you. Thanks.
Mm.
Thank you.
Thank you. That was a great presentation. Unfortunately, my camera is not working.
That's okay. We're happy to have you to hear your voice on the.
Yeah, that was a great presentation. Thank you.
Yeah, it was
Okay.
great.
Okay, everybody.
Yeah.
Good night.
Bye.
Wish you enjoy
Good
your
night.
weekend.
Yeah.
Yeah.
Bye-bye.
Yeah. Bye-bye.